Well, kia ora koutou, no mai haere mai ki te manatu hauora. Welcome back. Here, I know at least one of you is excited to be up at the Ministry of Health this afternoon. Last night we were informed of one new border-related positive COVID-19 case. This new case is a 24-year-old worker at the Grand Millennium Managed Isolation Facility whose positive test result was following a test on Tuesday. The case is reporting having had a sore throat 4 days ago, and this person has not yet been vaccinated. The PCR swab returned high CT values of 33 and 35, so around the mid-30s. This can mean either that they are early on in their infection, or that they are nearing the end of their infection, or that it is an historical case. An urgent repeat PCR test and blood serology are being carried out today to give us a better understanding of just what the picture is here. The person lives alone, but Auckland Regional Public Health is investigating whether there has been any contact with people in adjoining accommodation. The case travels to work by private vehicle with a colleague. And this colleague was informed last evening as well that they are a close contact and they are self-isolating at home. I should say the case's colleague has been fully vaccinated and will be having a swab taken today. So Auckland Regional Public Health officials have this morning carried out the scoping interviews with the case to determine any potential locations of interest. And at this stage there are none to report. The case worked over Easter and appears to have worked night shifts over the Easter period and was not at work yesterday and did not visit anyone yesterday. If and when locations of interest are identified, we will notify those, including on the Ministry website, and we will send out any push notifications via the app to people who may have been at those locations at the relevant times. So whole genome sequencing on the case's test sample has been started. However, because that is a high CT value in the mid-30s, this means the person is likely to have a low viral load and the sequencing run therefore takes more time if it is going to be successful, and we're not expecting it to be completed until tomorrow afternoon. But ESR will look to run a further, faster whole genome sequencing if today's PCR test shows a lower CT value, which would imply a higher viral load and the likelihood of being able to get a result more quickly. So back to the Grand Millennium, you will be aware we previously reported a couple of weeks ago a cleaner at this hotel had tested positive for COVID-19. That was on the 22nd of March. The whole genome sequencing results for that case indicated it was the B117 variant, the one first identified in the UK, and that was found to be a close match to that of a returnee who had stayed at that facility, but the exact epidemiological link has not been able to be established. So saying, because of that earlier case and the case we're talking about today, we have decided to carry out an out-of-cycle infection prevention and control audit at the facility, similar to those previously done at the Pullman and the Grand MIQ facilities. We've also called a meeting of the Managed Isolation and Quarantine Technical Advisory Group about this case to provide a check and advice on the actions underway at the facility. Furthermore, and I think this is significant, today we are reporting 23 new positive COVID-19 cases, border-related, in managed isolation. 4 of these are historical and are therefore not considered to be infectious. However, the other 19 are considered to be acute. This is obviously a high number, and I'll have a bit more to say about this shortly. So our rolling 7-day average of new cases at the border is now 7. That's up over the last few days from 3. An additional 10 people have recovered, so our total number of active cases in New Zealand today is 95. And since the 1st of January, a total of 43 historical cases have been identified out of 363 in total. Now, information on testing and app usage will be in the media release that will go out shortly. I want to just paint a bit of a picture of the global situation, and many of you will be keeping an eye on this, but it's important for our high number of cases that we've identified in managed isolation today. There are a number of countries with reporting large numbers of cases, particularly in India, which currently is reporting a 7-day average of around 93,000 cases per day. The US is in second place with 64,000. Brazil, we know, is also a real hotspot, 63,000 cases being reported a day on average over the last week. Turkey, 43,000, and France, 36,000. There are also significant numbers of deaths being reported every day. I think yesterday Brazil reported for the first time that it reported 4,000 deaths in one day. And elsewhere in the US, whilst it is dropping, there's still 770 cases on average each day being reported in the US over the last week, 520 in India, that is on the increase, 410 in Italy, 380 in Poland, and 270 in France. And many of you will be aware in France last week they announced a requirement for a further significant restriction on movement, the equivalent of a lockdown for a 3-week period, because their intensive care units were overwhelmed. So, as has always been the case over the last year, there is a very active global pandemic of COVID-19 still underway. And sometimes it's easy to forget that here in New Zealand, where we have no transmission of COVID-19 in our community and are enjoying significant freedom of movement. But we can see from of these countries, currently India has the most steeply rising rate in reported cases. It is the third highest total number of cases since the start of the pandemic, with 12 million, after the US at 30 million and Brazil with 13 million cases. And the high number of cases in our managed isolation facilities being reported today and on a number of days recently have rightly prompted a question about the accuracy and value of pre-departure testing. Now, as explained yesterday, we did specifically take a look at what might be happening with these cases arriving from India. And our current assessment is that there's no reason to not take at face value the pre-departure testing documentation and results being presented by people travelling from India. From our assessment of the positive PCR results, test results here, our assessment is that these are recent onset infections being detected largely at day 0 or 1 on arrival here. And it supports the view that individuals are becoming infected during their journey within India to the two ports of from where they travel on to Dubai and then into New Zealand, that is Mumbai and Delhi. Now, you'll also be aware that in recent days, both those cities or the states they are in have imposed curfews, and of the approximately nearly 100,000 cases a day now being reported in India, around half of those are in the state that Mumbai is in. So there is a very active outbreak there. These rising rates of infection are therefore the most likely explanation for the substantial increase in the number of travellers here testing positive on arrival. And in today's number, 17 of the 24 cases are people who have travelled from India. We have been asked to and have provided advice to government about how best to manage the increased risk arising from this situation. That is the increased risk of in-flight transmission on those long-haul flights arriving in New Zealand, and also, of course, an increased risk to border workers working in the facilities and or others in those facilities. And an announcement based on that advice and advice from across government is expected from the Prime Minister this afternoon.